Now, let's discuss about hymen in female. What is hymen?
The hymen is a stretchy, collar of tissue at the entrance to your vagina. It is protected by your labia. It can be compared to a scrunchie, hair tie, with bunched-up tissue that expands when stretched, for example, during sex or using tampons, then returns to its bunched-up shape afterwards. Hymens come in many different shapes and sizes. They may have a ring shape, half-moon shape, or squiggly edges, with notches. All of these are normal. The size of the opening in your hymen also varies in size and shape.
What are the different types of hymen variants?
Here we go. Imperforate hymen, microperforate hymen, cribriform hymen, septate hymen. You can also watch the image in next slideshow.
Pause the video for some time to watch this image. What are the different types of hymen variants?
Let's read quickly. Imperforate hymen. A condition in which the hymen fails to open up and therefore completely covers the opening to the vagina, blocking menstrual blood and secretions from flowing out. An imperforate hymen may be noted at birth, but more commonly is diagnosed during puberty. An adolescent girl with an imperforate hymen typically presents with no menstrual period and abdominal or pelvic pain. This is due to the vagina being filled with menstrual blood that cannot exit. The patient may also have urinary symptoms, such as urinary frequency, urinary urgency, or feelings of incomplete voiding. Microperforate hymen. A condition in which the hymen has a very small opening. Menstrual blood and vaginal secretions can flow out of the vagina, but the patient may have difficulty or inability to use tampons or have vaginal intercourse. In some cases, a teen with a microperforate hymen may not realize that she has a very small opening. If she is able to place a tampon into her vagina, she may not be able to remove it when it becomes filled with blood. Cribriform hymen. A condition in which the hymen has several very small openings. Menstrual blood and vaginal secretions can flow out of the vagina, but the patient will be unable to use tampons or have vaginal intercourse. Septate hymen. A septate hymen occurs when the hymen has a band of extra tissue in the middle that causes two small vaginal openings instead of one. Menstrual blood and vaginal secretions can flow out of the vagina, but the patient may have difficulty or inability to use tampons or have vaginal intercourse. In some cases, a teen with a septate hymen may not realize that she has extra tissue. If she is able to place a tampon into her vagina, she may not be able to remove it when it becomes filled with blood.
How does the hymen change?
Your hymen changes because of. Your hymen changes throughout your life. Before puberty, your hymen is thin, and may be sensitive. During puberty, increased hormones, estrogen, cause your hymen and other vaginal tissues to become thicker and stretchier. During pregnancy, increased hormones cause your vaginal tissues to become even stretchier to allow for childbirth. Childbirth may also change the shape of your hymen and your vaginal tissues. With menopause and aging, your hymen and other vaginal tissues become thinner again, as estrogen decreases.
Does a broken hymen mean someone is not a virgin?
Actually, everyone born with a vagina has a hymen, a collar of tissue at the entrance to your vagina. Just as all bodies are different, hymens are also different. Looking at a hymen does not tell you anything about virginity.
Can you tell if someone is a virgin based on whether they bleed when they have sex?
No. You cannot tell if someone is a virgin or not based on whether they bleed the first time they have sex. About half of women bleed when they first have sex, and half of women don't bleed. Both are completely normal. Bleeding may come from small splits in your hymen or your vagina itself. The bleeding should be lighter than a period and should not last for more than a couple of days, as these tears heal quickly because there is a good blood supply. Some hymens are stretchier than others and will never split or bleed. It is impossible to tell, by looking at a hymen, whether you have had a sexual intercourse or not. Other factors such as vaginal dryness, not being aroused, turned on, skin conditions, infection or inflammation, and rough sexual contact can also cause bleeding.
Important facts of hymen.
Here we go now. First, the hymen doesn't cover the vagina. Second, hymens vary a lot in how they look. Third, the hymen stretches, it doesn't break. Fourth, virginity exams are not medically recognized. 5. Not everyone has a hymen.